There is one more topic. Cardiac cycle is one of the very interesting and very high yielding topic for the, you don't have the notes of that? Cardiac cycle notes, give madam the printout. Yeah. Mainly, doctor, I will discuss a few quick facts about cardiac cycle. This is also a very minor topic, but asked, we need to read it. You have it? Yeah. We have 7 phases in cardiac cycle. So let us start from first phase, atrial systole. Mainly you must know whether this phase is happening in systole or diastole. Whose systole, diastole we are talking about? Ventricles. Ventricular, systole, diastole may. Which of these events are happening? We need to talk. Atrial systole. Will it occur during ventricular diastole or ventricular systole? Ventricular diastole. That to which part? Last 1/3 of the ventricular diastole. Because when the ventricle gets filled from atria, first 1/3, why will it occur? Why that filling occur? The moment AV valves open, ventricles are in low pressure because they undergone isovolumic relaxation, pressure fell down. That made AV valves open. And atria are pregnant with blood. They received the blood from the SVC, IVC. And that blood gushes into the ventricle. First 1/3 is over. Second 1/3, because of the gravity. Atria are at higher level than gravity, the ventricles. Third 1/3 may atria undergoes systole and pushes the blood into the ventricle, which is called the atrial systole or atrial contraction. On ECG, what is the corresponding event? P waves are the depolarization of the atria. So atrial systole is preceded by the P waves of ECG. And if you take the pressure tracing, where is the pressure tracing? Yeah, this is the jugular venous pressure tracing. This A, C, V waves are there, no? That is jugular venous pressure tracing. Then we have inside the atria, if you place a probe and check, obviously atrial systole should cause a rise of left atrial pressure. Then that increased left atrial pressure will fire on the veins, because veins are draining into atria. And if you look at the venous pressure tracing, what do you find? A wave, which corresponds to the phase of atrial systole, is what need to be remembered. Then during this phase, how is the left ventricle? Left ventricle is receiving the blood from atria. It is not in a contracted state, it is a diastole. It is towards the end of its diastole. So it is in a relaxed state because AV valves are in an open state and blood is pushed by this contracting atria. And this atrial systole will kick that last bolus of blood into the ventricle. So what happens to the volume of blood in ventricle? It also increases, pressure also increases, atrial pressure also increases, jugular venous pressure curve mein A wave will appear. So these are all the things that need to be remembered. So if you take the pressure tracing, what do you typically find? In the left, there is a ventricular pressure. This, what is this color, doctor? I am color blind. What is this color? Blue, blue, purple blue. This purple blue is the ventricular pressure tracing, doctor. So during atrial systole, what happened to the purple blue line? There is a small kick, right? It got slightly elevated, right? So left ventricular pressure tracing will show an elevated blip at the time of atrial systole. You agree with me? Then how is the ventricular volume? The ventricular volume during atrial systole also will show a increase, a rise. Most important point we reached. During the time of atrial systole, which corresponds to which phase of the ventricle? End, last 1/3 of the diastole, we hear fourth heart sound. It is not normal in the normal adults. But in the people who are having left ventricular hypertrophy, suppose somebody has hypertension with left ventricular hypertrophy, in such a guy, the ventricular compliance is low. That is, if any first 1/3 filling over, second 1/3 is over, ventricle is lazy, it's not ready to receive any volume. Into that non-receiving ventricle, atrium will be shouting like a task-oriented wife on a lazy husband on a Sunday morning. Why don't you wake up and bring the vegetables from the market? It will say. That is heard as S4. So, S4 is heard when the task-oriented wife, who is atrium, which is undergoing systole, on a lazy hypertrophic ventricle, on a non-compliant ventricle on a Sunday morning, we listen S4. So, S4 corresponds to atrial contraction is what need to be remembered. Then, after atrial systole, what will happen? Ventricle got fully filled at the end of the atrial systole. And there is a isovolumic ventricular contraction following that. So, ventricle is contracting means what happens in the QRS complex? Typically, isovolumic ventricular contraction begins during the QRS complex. When the left ventricle contracts, the left ventricle pressure will try to start rising. Agreeable, no? Acceptable. As soon as the left ventricular pressure is more than that of the atrial pressure, because the isovolumic ventricular contraction, left ventricular pressure increased. When it is more than right atrial pressure, what will ventricle will be doing? It will be kicking the door and closing the AV valve. And the closing of the AV valve leads to which sound? First heart sound. So where is the first heart sound in this tracing? Here. That means we are talking about isovolumic ventricular contraction. When isovolumic ventricular contraction is happening, how is the left ventricular volume? It is isovolumic. So it should be stable. It should not change. Is what need to be remembered. How is the ventricular pressure? This is the pressure tracing here. It typically elevates in the isovolumic ventricular contraction. You agree with me? So that is what we need to fundamentally remember. So the closure of the tricuspid valve and mitral valve lead to first heart sound, which corresponds to isovolumic ventricular contraction phase. Now then comes rapid ventricular ejection. Yes, sir. Pressure got elevated in isovolumic ventricular contraction. So much pressure that it closed the AV valves, and further pressure is rising, and that rising pressure is sufficient enough that it is capable of opening the door, which is called the aortic valve. So aortic valve, when does it open, doctor? During the phase of the rapid ventricular ejection, third phase. Now the blood is rapidly ejected with the aortic valve being open, but the atrioventricular valve being in a closed state. The ventricle is undergoing the systole and vomiting the blood into the root of the aorta. And during this rapid ejection phase, most of the stroke volume is ejected. And because of that, what will happen, doctor, to the ventricular volume during this phase? It will fall down. From the isovolumic state, during the rapid ejection phase, it will fall down. But during that phase, what happens to the ventricular pressure? Ventricle is further contracting and pushing the blood into the root of aorta. Hence, it continues to increase during rapid ejection. Then if you look at the aortic root pressure, it typically increases. Why? Because a large volume of the left ventricular blood has jumped into the root of the aorta, hence aortic root pressure will typically elevate. And during this phase, when the ventricle is pumping the blood into the root of the aorta, what is atria doing behind? During that time, atria is getting filled from the SVC and IVC. And because of that filling, if you look at the left atrial pressure tracing, what will it show during the time of the rapid ventricular ejection? The left atrial pressure slowly keep rising because of the blood which is coming from the venous circulation. And the end of this rapid ventricular ejection corresponds to the end of the ST segment on the ECG. So P wave precedes atrial systole. QRS complex occurs during isovolumic ventricular contraction. And the end of the ST segment is the end of the rapid ventricular ejection. And after the rapid ventricular ejection, there is a reduced ventricular ejection. It doesn't stop abruptly. During that time, the ventricles undergo repolarization. And the beginning of the T wave on the ECG marks the beginning of the phase of reduced ventricular ejection. So, already majority of the ventricular blood is vomited into the root of aorta. Ventricle blood volume is very low. Hence, how is the ventricular pressure? Ventricular pressure will be falling. And ventricle is not really contracting anymore during the reduced ventricular ejection. And since the aortic valve is still open, the blood continues to leak into the aorta. And the ventricular volume continues to fall down, but at a reduced rate. And during this time, what will happen? Diastolic runoff, it is called as. That is, whatever the blood that has gone into the root of aorta will quickly become distributed into the arterial system. So that is the time, reduced ventricular ejection phase is the time during which the diastolic runoff of the blood typically happens into the arterial system. And what happens to the left atrium? What it is doing during this time? The left atrial pressure continues to increase because the blood is further returning. More and more blood is entering into from the great veins into the left atrium. I mean, from the pulmonary veins into left atrium and great veins into the right atrium. Then comes the phase called isovolumic ventricular relaxation. So once the ventricular pressure are low and the blood has moved into root of aorta sufficiently enough, the aortic pressure is big enough and the ventricular pressure is low enough. That is a motivation for closure of the aortic valve. How will that ventricular pressure will fall down? Earlier phase only, because of the emptying of the blood, it has fallen down to certain extent. But during isovolumic ventricular relaxation, which is typically marked by the end of the T wave on the ECG, the ventricle is relaxed enough that the left ventricular pressure dramatically decreases and the aortic pressure will become more than the left ventricular pressure, and that closes the aortic and pulmonic valves. And we listen what is called as second heart sound. If you take the past 15 years of AIIMS All India PGI question bank, routinely asked question, second heart sound corresponds to which phase of the cardiac cycle? What is your confident answer? Isovolumic ventricular relaxation. First heart sound corresponds to isovolumic ventricular contraction, right? These are the two favorite MCQs of the examiner. Then when the aortic valve closes, the aortic pressure curve will show a small blip which is called as the dicrotic notch or incisura is what you need to remember. And because all the valves are in a closed state, aortic valve front and mitral valve behind, the blood, the volume of the blood typically is not altered, only pressure will fall down. That's the point of interest. Hence it is called isovolumetric. Then comes opening of the AV valves and rapid ventricular filling. Typically, the moment isovolumic relaxation brings down the ventricular pressure to such a low value, then the aortic valve, the mitral valve will open and tricuspid valve will open and blood will run, which is called rapid ventricular filling. We hear what is called opening snap. You remember? Opening snap, that typically is associated with this phase of the opening of the valves, which typically happen during this phase. Suppose if a person is having ventricular failure, what will happen? Normally ventricle is expected to pump the blood which it received during diastole. Magar wo काम नहीं किया because of the ventricular failure. So next time when it is getting filled, the earlier blood which was not emptied, which was not pushed into aorta, no, it remains stagnant in the ventricle. You understood? So this rapid filling phase where is the blood jumping into? Into the aortic ventricular wall, or already some stagnant pool of blood, which the ventricle is unable to pump in the earlier systole. It is jumping into a pool of blood which the ventricle failed to pump earlier. Into that this blood is jumping in a LV failure. That's the reason during this phase we can listen what is called third heart sound, is what you need to basically remember. Then comes the last phase, which is reduced ventricular filling, and second 1/3 of diastole this is. And at the end of this reduced ventricular filling, whatever the volume that is there in the ventricle is called as end diastolic volume. End diastolic volume means a lot of people think at the end of the entire diastole. No. At the end of the first 2/3 of the diastole, without any atrial contraction, whatever the blood remaining in the heart is called as, ventricle is called as end diastolic volume, is what you have to fundamentally remember. And this is a very, very important phase, that is called as reduced ventricular filling phase. Why? This is also called phase of diastasis. This is during this phase, how much volume the ventricle is getting filled is going to get decided. If I am having a rapid heart rate, then the amount of time the heart has spent on this slow reduced ventricular filling state will become decreased, and obviously my stroke volume gets compromised. So that is what typically happens. So that is all the story, doctor, which we need to basically remember. And one more common question asked is, of all these phases, which is the longest phase? It is the second 1/3 of the diastole, during which reduced ventricular filling is happening, is considered the longest phase of the cardiac cycle. It is also called the phase of diastasis, and it is during this phase how much stroke volume is going to be there is decided, and the end of this phase, whatever the volume that is there in the ventricle is called the end diastolic volume, is what you need to remember. So this gives you the complete summary of what all that we have discussed. So doctor, that brings us to the end of the story. 8:25 is quite a long journey. Thank you very much for a patient listening.